Let's say one bee or wasp has bitten me few minutes ago. So that wasp injected some venom in my intradermal tissue. In response to that, my body will mount immune response. To prevent it spread to whole body and to neutralize the toxin. So locally here where the wasp has bitten, the blood vessels will dilate and inflammatory cells will come out, right? And there is localized reaction. So that is one possibility. Another possibility can be that my whole body immune cells got hyperactivated in response to the bite of that wasp or the venom that has been injected. So if the mast cells of my whole body is activated in response to that, what happens? Histamines will be produced everywhere. So in blood vessels, histamines dilate the blood vessels. So when blood vessels are dilated, systemic vascular resistance will be decreased and it will cause hypotension. In the bronchus, bronchioles, due to those histamine, smooth muscles will constrict and there will be narrowing of those bronchus, bronchioles, and air will have difficulty entering inside the alveoli. Similarly, mast cell reactions will occur on other body parts as well, on this skin, on back, on face, right? So the reaction should have been localized here only, but it is occurring in a generalized fashion. I am having urticaria, skin rash, otherwhere in my skin, my lips are getting swollen because of the vasodilation in the lips, right? My oropharynx is getting congested because of the vasodilation there. My necks are getting congested, blocked because of the vasodilation. So this is generalized mast cell activation. So one possibility can be that as well, that we call anaphylaxis, that is exaggerated immune response to antigenic exposure. So whether my immune system will demonstrate localized reaction or generalized will depend upon my genetics. There is one hypothesis called hygiene hypothesis. Basically, they want to tell that if you have been exposed to multiple allergens in your past many times, then there is less chance that you will demonstrate allergic reaction to anything. Not anything, but something, let's say. For example, I have grown in a third world country. There is a lot of pollution, there is water pollution. Environment where I lived in my childhood was not sanitized like in developed country. So I grew up in dirt, dust, right? Pollution. I drink polluted water. If that water any person from developed country would drink, he will get acute gastroenteritis. That type of water I have also drunk in my childhood. So due to that, what occurred in my body is that a type of immunotherapy occurred. In immunotherapy, what they do, they inject a small dose of the allergens so that your body mounts little immune response, and your immune systems will become adapted to that. Similarly, in my childhood, I got exposed to cow dungs, I got exposed to many plants, flowers, pollens, right? I drink polluted water. There were many bacteria, viruses. Sometimes I suffered acute gastroenteritis, sometimes I did not. But my body immune system slowly get adapted to those allergens. And now my body do not demonstrate hypersensitivity reaction to those types of allergens. Currently, I do not have any type of allergic reactions, either skin allergy, respiratory allergy, or gastrointestinal allergy. So I think hygiene hypothesis is not just hypothesis, it is a true statement. This is what occurs in our psychology as well. When you are not faced with any difficult challenges, then the first time you will get overwhelmed, right? But when you get little, you are used to doing those little difficult tasks, then when difficult task even comes, you are able to handle it. So that is low dose exposure of stress or difficulty in life is essential, because it will immunize you to big difficulty. You do not get overwhelmed. This occurs in psychology as well. So similarly, it occurs in immune system. Everything in the nature, if you see carefully, everything works in a same manner. Not only in human body, in the surrounding plants, anything if you observe carefully, the basic principle is same. I have realized it. So I was talking that sometimes your immune becomes overwhelmed and there is generalized allergic reaction, can be bronchoconstriction, vasodilatation. In that we have to give supportive treatment, like we have to give bronchodilators to dilate the bronchus, we have to give epinephrine to constrict the vessels. Initially we give intramuscular epinephrine, but if that does not helps, then we have to give intravenous epinephrine. If that is not also helping, then we have to give norepinephrine infusion. So basically we are trying to vasoconstrict vessels and dilate the bronchus. And these urticaria, angioedema, they will also slowly resolve with that, because we are vasoconstricting. So when blood vessel constrict, there is no further leakage, and this angioedema, oropharyngeal congestion, this starts to subside. And we also give steroid, glucocorticoids like methylprednisolone, prednisolone. We do not give much dose, like we have to give for 1 or 2 days, not more than that. It is not helpful if you give more than that, neither it will harm. So glucocorticoids, what they do is that it helps to control the inflammation, minimize the inflammation. Previously, when I was in medical school, they used to tell that it will help to prevent biphasic reaction. But there are some studies, they tell that it does not prevent biphasic reaction. Biphasic reaction means like when you got exposed to any allergen, you will develop one hypersensitivity reaction, type 1 hypersensitivity reaction. After 12 hours or up till 72 hours, you will demonstrate another hypersensitivity reactions, type 1 hypersensitivity reactions. But glucocorticoids does not prevent that. You have to admit the patient and you have to observe the patient, and if patient develops biphasic reactions, second reactions, then we again have to support that. So why does biphasic reaction occurs is that, in acute inflammation there are some cytokines that mediate these things that I told you, but there are also slow release cytokines, delayed acting cytokines, and those delayed acting cytokines act after 12 hours, 24 hours, up to 72 hours, and there can be another spike of type 1 hypersensitivity reactions. That's why we observe patient for up to 72 hours. If any patient develop anaphylaxis, then we observe for 72 hours, because there is chance of second phase of reaction.